Hello, Dr. Bernard. How are you today?
Good evening. I'm fine. Yourself?
Very fine. Thank you for asking. So today I'd just like to ask you some questions about your roles, um, and also how you communicate with other healthcare professionals in order to help me understand how we can potentially collaborate with each other and help treat my stroke patients. So first, I'd like to ask you, how long have you been working as a doctor?
So far, I'm entering my second year as an SHO in Ireland and under the HSC. So I've worked 2 full years as a doctor, and I'm entering my third year.
Okay. Okay. So in total, you've worked like 3 years, so two
No,
years
two
in
years,
total.
and I'm starting my third year.
Okay, yes, good to hear. And I also like to know more about like your roles as a doctor. So, um, you like your, um, where specifically do you work?
At the moment, I'm working in a nursing home, but
Yeah.
I also do shift work in the emergency department in different hospitals around my area.
Okay.
Usually to cover shifts like night shifts and weekend shifts. So my 9 to 5, Monday to Friday, is spent in a nursing home slash rehab hospital
Okay.
in Dublin.
Yes, and I also like to ask, do you have experience treating stroke patients as well?
Yes,
Okay.
at the start of my second year, for the
Yeah.
first 8 months, my job was the geriatric team in James's Hospital.
Okay.
Um, this was from July 2023 up until March 2024.
Hmm.
Part of that geriatric placement was to cover the stroke team as well on
Yeah.
call. So I never rotated onto the stroke team directly, but I had to cover the stroke call bleep. And over time, there'll be overlap when I was doing a weekend shift with the stroke team because I'd be responsible for the stroke team patients.
Yeah.
And night shifts and evening shifts as well. It would just be myself and the consultant that would be kind of covering the stroke team.
Okay.
So hope that answers your question.
Yeah. Yeah. Thank you very much. I'd also like to ask, in terms of how you communicate with other healthcare providers, how exactly do you go about collaborating with them? Like, for example, if you guys have meetings or presentations, is this done through, do you have like a sort of email or is it done physically, if that makes sense?
Well, I
Like,
can
how
just
do
go
you,
through everything for you.
yeah,
Um, if I was to admit a stroke patient on a call shift, so nine
yeah,
to five, there's a stroke team with the stroke nurses, the stroke consultants, the SHOs, the reg. It's like a full and the intern full team. The physios and OTs are there as well. The speech and language therapists are there from 9 to 5. But like I
okay,
said, once it's evening time, that's when I come in and I'm covering the evening shifts or the night shifts on a week of nights. Or if I'm on a weekend, then it's me covering the stroke ward. So in James's Hospital, they had a stroke unit. So
yeah,
if a patient came into the hospital with a confirmed stroke, and this is after doing the NIHSS scale and getting a CT image that shows, stroke,
yeah,
then they automatically get admitted to the stroke ward. Um, it's never really been an issue that the stroke ward is over full with stroke patients. Usually, there's patients that are able to move off the stroke ward at any point, so you could always
yeah,
make space. But automatically, they get moved to the stroke ward where they're assessed by the stroke nurses. So
okay,
they're not the stroke CNMs, but they're nurses that are equipped to deal with strokes. So they would usually, when I was starting off, especially, they would usually
yeah,
advise me on how to, assess patient swallow and the Torbests for, assessing dysphagia after a stroke.
mm-hmm,
Usually, I would leave a patient NPO up until the next day because if they've just had a stroke, food is literally usually the last thing on your mind.
yeah,
On a weekend, it gets a bit more difficult, or like a bank holiday weekend. Then
yeah,
we need to properly assess your swallow. Otherwise, the next day, if a patient is on the stroke ward, the stroke physiotherapists, the stroke OT, and the stroke speech and language therapists are automatically aware. And on the weekends
okay,
as well, there's always a stroke physio, OT, and SLT that are around. So when a patient with a stroke comes in and they get onto the ward, the MDT
yeah,
is automatically aware. And James has had an EPR, an electronic patient record, so we could all see our notes pretty much in real time. Like you could be logged into different computers in the hospital and see what everyone's kind of doing and everyone's thinking. And we usually just talk to each other as well. Like we don't always have to read the notes because sometimes it gets a bit
Yeah.
complicated, or you don't put as much detail. I remember one time actually on the weekend, a new stroke came in the night before, which I wasn't aware
Hmm.
of because I didn't admit them. I was doing the weekend day, and I was writing up a
Yeah.
note just to talk about the patient's blood pressure and all the vitals I had to monitor.
Yeah.
And the stroke physio actually walked up to me. I was asking if they needed physio over the weekend, and I realized it's only because as I was typing the note and I saved it, she saw it on her
Yeah.
computer in her office at the same time and realized there was a stroke patient that she might have missed. Um,
Okay.
so either way, the patient didn't need any physio. It was pretty low, like disability. So you could
Yeah.
wait till the morning, Monday, to get assessed properly.
Yeah.
But that's kind of an example of how we would interact in
Communicate.
that particular hospital.
Yeah.
If it was a paper chart system, there, like I've worked in a hospital where there's a paper chart system and for the stroke team. But usually what I know is a lot of hospitals that are equipped to manage strokes would have a stroke ward. And so there'd be a dedicated stroke team there as well. So there wouldn't be really much need to officially meet, but I'm sure there is an MDT, you know.
Yeah.
And in terms of overall teaching, like for example, I mentioned the Torbest, which is a speech and language therapy skill, but something that as doctors we'd have to know anyway to some extent. Um,
Mm.
there was no way we'd learn that in medical school because it's very specific.
Yeah.
So at the start of the year, every Friday we would have an hour from 1 p.m. to 2 p.m. of teaching, and occasionally it would be the stroke team teaching. So the occupational
Mhm.
therapists, speech and language therapists, and this would include the geriatric team as well on occasional weekends or on occasional Fridays. But some of those teaching sessions were from the stroke MDT to tell us what they would need from us to kind of ease us into the job of being doctors on the, potentially covering the
Yeah.
stroke team. The CNSs as well gave us a tutorial when we first started off on the job, to explain what our roles would be really. Because medically we knew what strokes were and how to manage a stroke, but it's a very
Yeah.
different thing to actually doing the real life job and involving the whole MDT. So that's pretty much how we go about it.
Yes. That just about answers most of the questions I was going to ask. So thank you very much. But in relation
No
to my
problem.
case, I'd like to ask you. So basically, my patient has a right ischemic stroke, and she's had a stroke for 2 weeks. Um, so I'd like to restore her of her function, and her goal is to basically go back to doing her activities of daily living. Um, so I'd like to ask, in your opinion, um, how, in terms of making a care pathway for this patient, um, how would you kind of assist me in communicating with you as well as the other, like the nurses, as stakeholders to help treat this patient?
I'm not
If
sure
you,
what your question is, like how I would help you as a physiotherapist treat the patient.
yeah. So basically, I'm trying to help her restore her function and go to back to her activities of daily living. So I'd like to ask you, in terms of how you communicate with other healthcare providers, um, h- how can we kind of collaborate together in order to help the patient? Like, would you prefer us doing it through meeting, like Zoom calls, or in person?
In person is always better.
Okay.
Um, like I said, different hospitals have different setups, and
Yeah.
even within hospitals, there's different setups for how different departments manage things. But usually, every specialty and subspecialty has an MDT where everyone would go into a room and talk about a list of patients. So I
Yeah.
would assume, because like I said, I was never actually on the stroke team. I would just cover the stroke bleep on call
Yeah.
and occasionally get teaching from the stroke team. But I would assume they had an MDC as well, because the computer system would not be reliable enough. So you said a patient had a right ischemic stroke. Depending on the size of it, they could have like a pretty big disability. So the first thing is to give them a realistic goal. So
Yeah.
whenever, like, my story of the weekend physiotherapist that, assessed the patient briefly and saw that wasn't too big of a deficit. I was wondering if, medically I was concerned about anything. That was a quick like talk at the nurse's station. Um, but if it was the opposite and she had a pretty big deficit, then I would, ask for a formal, assessment and a plan for the weekend, or what, we can tell the patient to expect over the weekend. Then the consultant who would have the most experience dealing with strokes would be able to tell the patient from, anecdotal evidence what they've experienced, because everyone's different. But with the experience of a senior physiotherapist and a senior doctor, they could at least give the patient a realistic goal to aim for.
Yeah.
So that'll be the first thing to do, and that can't be done without a face-to-face conversation between the
Yeah.
MDT.
Okay.
Physio will go in, make an assessment. Doctors would also go in, make separate assessment.
Yep.
But before the patient is told, everyone has to be on board with,
The
what they're
overall goal.
expecting. Otherwise,
Yeah.
it just crosses wires.
Okay. Yeah. So that just about answers my question. In terms of the goals of the patient, we're trying to basically help her balance herself. So we're doing some transfers from lying to sitting, helping her stand, do some reaching, and we've also done some mobilization techniques as well. So just to basically help her with daily activities like walking, balancing, transferring from sitting to standing, and hopefully building strength in her muscles as well. So what I can conclude from our conversation is that in order to effectively treat this patient, you would prefer us having a more face-to-face conversation then.
Yes.
Okay. Okay, that's just about answers my question. Thank you very much for your time, Dr. Bernard, and I look forward to working with you soon.
Thanks very much. All right.
Thank you.
Bye.
Bye.